I am Maria Laura Di Tella from the Department of Psychology of University of Turin, Italy, and I'm going to present a study that investigated the presence of mental health symptoms in nurses and physicians working in Italy after the COVID-19 outbreak. The present research has been carried out in collaboration with Miss Agata Benfante, Professor Loris Castelli, and Dr. Annunziata Romeo from University of Turin, Italy. The COVID-19 pandemic represents one of the most stressful events in recent times worldwide. This pandemic poses a major challenge to social, economic, and above all, psychological resources of the population. Undoubtedly, among all categories, healthcare workers are the most exposed one. Indeed, during the COVID-19 pandemic, nurses and physicians faced exhausting work conditions, making ethically and morally difficult decisions, and taking health risks for themselves and their loved ones. This situation also affected their mental health, with high levels of anxiety, depressive, and post-traumatic stress symptoms that have been reported by nurses and physicians since the early months of the pandemic. Taking into account both the current situation and the available evidence, the present study mainly aimed to assess the psychological impact of the COVID-19 outbreak on nurses and physicians working in Italy. In order to reach this goal, possible significant differences between nurses and physicians on socio-demographic and work-related aspects and psychological factors, namely anxiety and depressive symptoms, post-traumatic stress symptoms, and health-related dimensions, were evaluated. The data were collected using an online survey from March 19 to April 5, 2020. By means of convenient sampling, nurses and physicians working in Piedmont, one of the most affected Italian regions, were selected to carry out the survey. In order to promote the survey, participants were encouraged to pass the link to other colleagues. The responses of 73 nurses and 72 physicians were included in the final dataset. Participants were asked to provide socio-demographic and clinical information, namely age, gender, being not being in a romantic relationship, having not having a medical condition, together with work-related data, namely the type of ward in which they worked, COVID-19 unit or another unit. Moreover, participants were asked to complete the following measures: 2 visual analog scales to investigate health-related dimensions, the state rate anxiety inventory form 1 to assess anxiety symptoms, the back depression inventory to evaluate depressive symptoms, and the PTSD checklist for DSM-5 to assess post-traumatic stress symptoms. In order to investigate the psychological impact of the COVID-19 outbreak on nurses and physicians, Chi-square tests and independent t-tests were performed to evaluate possible differences between those two groups on socio-demographic, clinical and work-related variables, health-related questions, and psychological variables. Table 1 presents the results of comparisons between nurses and physicians. Significant differences between those two groups were found on both visual analog scales we used for the assessment of health-related aspects. Indeed, nurses rated lower their health and were more worried about contracting the infection than physicians. Similarly, significant differences emerged between nurses and physicians on anxiety symptoms and post-traumatic stress symptoms, with the former reporting higher scores than the second ones on the STAI and PCL respectively. Figure 1 shows a graphic presentation of the statistically significant differences we detected between nurses and physicians. It is possible to see how nurses scored higher on both health-related items and psychological outcomes with respect to physicians. The present findings show that nurses rated lower their health and reported to be more worried about contracting COVID-19 with respect to physicians. Similarly, nurses reported higher levels of anxiety symptoms and post-traumatic stress symptoms compared to physicians. These results are not surprising considering the nurses are usually one of the healthcare professional groups dealing with patients at the front line across healthcare settings, and for this reason they are continually exposed to stressful events. Particularly during the COVID-19 pandemic, being more in contact with risky patients than physicians makes nurses more vulnerable and at risk to develop psychological distress. In line with our findings, previous studies show that post-traumatic stress symptoms and anxiety symptoms were significantly higher among nurses than physicians. Spending much more time with patients may also explain nurses' greater fear of contracting infection. Indeed, a previous study of Sampaio and colleagues confirmed our results, showing that nurses reported an increased fear of being infected and consequently of infecting their loved ones, leading to high levels of psychological distress. The present study has also some limitations that should be acknowledged and that future research should overcome. In particular, the cross-sectional design of the study, the reduced number of participants that were enrolled, and the exclusive use of self-report instruments. Despite those limitations, the present results highlight that nurses experience higher levels of anxiety symptoms and post-traumatic stress symptoms and are more worried about contracting COVID-19 compared to physicians. Therefore, it is essential to pay attention to the psychological health of this healthcare professional group, especially in the aftermath of the COVID-19 outbreak. Thank you for your attention.